Can you use directional terms correctly in body planes? Have you ever wondered how we can accurately describe where something is in the body? It all comes down to using directional terms in relation to body planes. Let's break this down in a simple way. First, we need to understand the anatomical position. This is the standard way we refer to the body. In this position, a person stands upright, facing forward, with arms at the sides and palms facing forward. This gives us a clear reference point for describing locations. Directional terms help us pinpoint where something is in relation to this position. For instance, when we say anterior, we mean toward the front of the body. On the other hand, posterior refers to the back. Similarly, superior means toward the head, while inferior means toward the feet. Now let's talk about medial and lateral. Medial means closer to the midline of the body, while lateral means further away from it. Proximal refers to something closer to the trunk or point of origin, and distal means further away from that point. Next, we have superficial and deep. Superficial means closer to the surface of the body, while deep refers to structures that are further away from the surface. Body planes are imaginary lines that divide the body into sections. There are three main planes we use: the sagittal plane, the coronal plane, and the transverse plane. The sagittal plane divides the body into left and right parts. When we use terms like medial and lateral, we are referencing this plane. The coronal plane, also known as the frontal plane, splits the body into anterior and posterior sections. Here, we use terms like anterior and posterior to describe locations. Finally, the transverse plane divides the body into superior and inferior parts. This is where we use superior and inferior to indicate positions. Using these directional terms correctly is essential. For example, if we say the heart is medial to the lungs, we mean it is closer to the midline. Similarly, if we say the stomach is inferior to the lungs, we are indicating it is below them. In practical situations, knowing how to use these terms helps in medical settings. It allows for clear communication about the location of organs, tissues, or injuries. This clarity is vital for interpreting medical images, conducting physical exams, and discussing surgical procedures. So, yes, you can use directional terms correctly in body planes by understanding the anatomical position and how these terms relate to the planes that divide the body. This knowledge creates a universal language in anatomy that is essential for anyone studying or working in health-related fields.